And other classifications of experimental study design is again based on the method of treatment administration. So based on the method of treatment administration, we classify the study designs as parallel treatment. So in the parallel treatment, individuals in each group simultaneously receive one study treatment. So the treatment and the comparison groups consists of different study participants, no overlap between the two groups. And one group will only receive a single treatment. That is based on the method of treatment administration. So group 1 will receive treatment A and will be followed to assess the outcome. And group 2 will be receiving treatment B with different participants and again will be followed and assess the outcome. That is the parallel treatment based on the method of treatment administration. So this is a graphical display. And the second type of study design or experimental study design based on the method of treatment administration is a crossover design. Crossover design. So in the case of crossover design, two or more study treatments are administered one after the other to each group. So we will have at least two treatments or two agents, and we'll have two groups, so that one treatment will be given. For example, if we do have treatment A and B, and actually there might be a graphical representation over here, Yeah, I do have a graphical representation. There is group 1 and there is group 2. We do have two treatments, treatment A and treatment B. So now randomly, treatment A is given for group 1 and treatment B is given for group 2. Now we will follow to assess the effectiveness of this drug among these groups. And then we will stop giving the drug for the two groups. And then we will just wait for the washout period of the drug in order to just avoid the effectiveness of one drug to another. We need to wait for the washout period of the drugs. That is the duration of action of the drug. Period will be just over. Then after the washout period, now for group 1 we will give treatment B. And then for group 2 we will give treatment A. And then we will follow them and then assess the outcome. You see? So all the groups will receive the treatment one after the other. So that what makes crossover design different from the step-weighted randomized controlled trial. One, randomization is taking place in the crossover design at the individual level. Okay, the second one is the randomization also takes place simultaneously at one point in time, not step by step. So that is the difference between the crossover study design with that of the step-weighted cluster randomized trial. So, a new treatment is compared with current treatment. Subjects are randomized to new treatment or current treatment. After being observed for a certain period of time on one therapy, and after any changes are measured, the patients are switched to other therapy. So that means both groups are then again observed for a certain period of time. So, finally, each patient can serve as his or her own control, holding constant the variation between the individuals in many characteristics that could potentially affect a comparison of the effectiveness of the agents are constant or controlled by randomization. So because an individual A is taking a drug 1 at one point in time and then drug 2 in another point in time, so that each patient can serve as his own control and treatment group. So what will be the improvement of the disease when the patient is taking drug A will be compared to the improvement of the disease for that patient when he is taking drug B. So the effectiveness of the two drugs will be measured in terms of the improvement of the disease in a among the same individuals. So this is a graphical display of the crossover design. So studies of the efficacy of therapies intended to reduce the frequency or severity of chronic recurrent problems such as seizure, arthritic pain can lead to more precise estimates if the subjects can serve as their own control, So any variation in terms of the confounding variables between the control and the treatment group will be just cancelled out if we use the control history of the same individual as compared to the treatment group. So that will be the importance of using crossover study design. So patients receive different therapies during different periods of time. So the rates of outcomes of the event, like for example seizure or levels of symptoms for joint pain that are present during and at the end of the periods of time will be compared within the individuals when they are taking the drugs at different points.